Hi, I'm David Spring with the Washington Family Rights Coalition. This is the 10th of 12 sessions presented at the FTC workshop on July 9th, 2025. In this session, we hear from several whistleblowers who put their careers on the line in order to expose the lies of the trans drug cult. Here are our courageous whistleblowers.
Now let's shift gears a bit. We've talked with medical professionals, we've talked with parents and survivors and heard their stories. But as the truth emerges, it's important to note that a number of truly courageous people took great personal, professional, and financial risks to themselves to blow the whistle on the gender industry. And I'm pleased to announce that we have 6 of these whistleblowers at this workshop today. Earlier you heard from Dr. Etan Heim, and now we have a panel with 5 more. These are individuals who truly paved the way for this moment. So I'd like to introduce our moderator for this panel. He serves the Federal Trade Commission as a special advisor in Chairman Ferguson's office, Ian Mason.
Well, as John mentioned, we've heard today the personal stories of young people subject to so-called gender-affirming care and their parents. We've heard doctors and researchers reason conclusions about these practices, but the understanding, especially the popular understanding of what's happening, depends on an additional pillar. The accounts of whistleblowers, actual participants in this industry who had the courage to come forward despite potentially devastating consequences for their careers, for their reputations, and for their families. We're grateful to have 5 of them with us today. Jamie Reed is the executive director and co-founder of the LGBT Courage Coalition, which advocates for cultural and medical approaches that accept and support gender nonconformity without medical intervention. In February 2023, the Free Press published her explosive firsthand account of her time in a pediatric gender clinic. Jamie holds a Master of Science in Clinical Research Management from Washington University, and a BA in Cultural Anthropology. She co-hosts the Informed Dissent podcast, has been profiled in the New York Times, advocates for legislation across the country, and addressed a rally on the steps of the U.S. Supreme Court during the U.S. v. Scrimeti oral arguments. Tamara Petsky is an independent clinical social worker in Washington State. She earned her Master's of Social Work from the University of Washington, and after more than a decade as a mental health therapist in community and healthcare settings, she founded her private practice in 2024. In 2023, she gained national attention for speaking out about the mental health field's approach to youth gender transition, raising concerns about blind affirmation without adequate assessment, leading to a backlash including the loss of her job and an ongoing state investigation. Leda Boylan is a former psychiatric nurse at a taxpayer-funded facility for teenagers and adolescents. During her time there, she became aware of a series of institutional policies that promote and reinforce social transition of minors while hiding such treatments from their parents. Due to Leda's unwillingness to lie to parents and engage in dishonest, incomplete documentation, she was targeted by the facility's administrator and fired in December 2024. Vanessa Sivage is a pediatric RN who exposed the illegal use of Medicaid to cover sex hormones and transgender treatments for minors at Texas Children's Hospital. After blowing the whistle, Vanessa received a visit from 2 FBI agents in July of 2023. Despite this and other threats, Vanessa came forward in June of 2024 with journalist Chris Rufo to expose the Medicare fraud, medical malpractice, and illegal billing in the gender clinic. 2 months later, Texas Children's Hospitals fired Vanessa. Vanessa has since launched an advocacy organization committed to fighting for the protection of children in the state of Texas, called Protecting Texas Children. Sarah Stockton is a licensed marriage and family therapist, lecturer, researcher, and clinical supervisor with over 15 years of experience specializing in gender dysphoria among youth and families. In 2023, she co-authored one of the U.S. mental health assessments for evaluating youth readiness for medical gender transition, published in the Journal of Marital and Family Therapy. Growing concern that prevailing clinical approaches were harming young people, Stockton publicly addressed these issues in the 2022 documentary, What is a Woman? She testified in state legislatures on bans regarding transgender care for minors and served as an expert witness in family court cases involving child protective services. So we're here today largely because of your stories raising awareness of these issues. So why don't we start with those stories themselves? We'll just go down the line. Vanessa, would you like to start?
Thank you so much. My name is Vanessa Sivage. I'm honored to be speaking on today's panel on blowing the whistle on gender medicine, to join my voice with the growing number of medical professionals who recognize gender medicine for the farce and the fraud that it is. For 10 years, I've had the privilege of working as a pediatric nurse in Houston, Texas. In 2018, I accepted a job at Texas Children's Hospital, the most prestigious and largest children's hospital in the United States in Houston. And I thought at the time that I had peaked in my career, convinced that I would be working here until I retired. A couple of years later, in 2021, I transferred to a multi-specialty outpatient clinic, not knowing that a fully functional and robust gender clinic was active in my workplace. The things I saw over the next few years, I will never unsee. Eventually, I was asked to do things that went against my nursing ethics, my personal beliefs, and most importantly, my faith in Christ. I had a crisis of conscience one day when a physician, the transgender physician, asked me to do patient teaching, which is not uncommon. Nurses do a lot of patient teaching in the hospital. But on this particular day, I walked into a patient's room, and I was asked by the doctor to instruct them on how to administer an intramuscular injection. What I didn't know was that this child, this boy, was going to administer estrogen to himself to affirm the false identity that he had adopted. And realizing that I enabled him to do that was devastating to me. I considered quitting my job. I could no longer play an indirect role in perpetuating these harms against children. Until one day in May of 2023, when I read an article by an anonymous whistleblower within Texas Children's Hospital, who had come forward courageously to expose that the hospital had been secretly providing transgender treatments to children, had hidden this from parents and from lawmakers in the state of Texas. And I knew this to be true because I was the nurse, one of the nurses working at this clinic that was supposedly non-existent. This person is Dr. Eitan Heim, without whom I would not be here today. We did not know each other at the time. We had no knowledge of who the other one was. But what I did know was that someone within the hospital had shared my concerns and was deeply concerned about these children being harmed. And so a couple of days later, I came forward anonymously to corroborate his testimony as a nurse working in the clinic where this was taking place. And that was supposed to be the end of the story. I was going to go back to work, and things were supposed to go back to normal. But 2 months later, in July of 2023, my husband and I were having dinner on a Monday night, and there was a knock on the front door. And lo and behold, we go to open the door, and there are 2 federal agents who are flashing their badges. They say they're from the FBI, and they're asking specifically to speak with me by name regarding issues at my work. And in a video that has now been viewed over 6 million times, because our Ring camera captured this exchange at the front door, these agents informed me that I was a person of interest in an investigation targeting a leaker, not a whistleblower, but a leaker who had allegedly violated patient confidentiality laws by breaking HIPAA, which was, of course, an utter fabrication and a complete lie. And I knew at that moment that they were lying to me. They were trying to turn me and to use me to eventually testify or speak against Dr. Heim, if it ever came to that. Thankfully, it did not. But they informed me that they couldn't protect me if I didn't help them, that I was unsafe, that my career and my safety were at risk. And it was the most terrifying encounter we've ever had at our front door on a Monday night. And so that really set the stage for what happened next. I went back to work. Of course, no one knew that this had happened, but I think we saw this a lot during the Biden-Harris Department of Justice era, where whistleblowers, people with a medical conscience and a moral spine, pro-life people were targeted because of what they believe, or just because they believed they were doing the right thing. And so we were no exception to that. But I went back to work and I discovered that not only had the hospital lied to the public about the existence of this secret program, but they were also billing Medicaid fraudulently for these cross-sex hormones and puberty blockers, which in Texas is a violation of state law. I saw, children that were misdiagnosed intentionally. I saw false diagnoses. I saw all these things that were deeply concerning and 100% illegal. And I knew that I had to come forward at that point to expose that the hospital was committing fraud against the federal government. And so in June of last year, I came forward publicly with my identity, was promptly placed on leave by the hospital, and in August of last year, the hospital fired me. And this was illegal for a number of reasons. I had also submitted a religious accommodation request. So we retained the Burke Law Group, Marcella Burke, who is an incredible attorney. And I'm so grateful for attorneys all around the country who are really defenders of truth and who are on the right side of this issue. And then Donald Trump was elected president. And 3 months later, the Trump administration, under the leadership of Secretary Kennedy at HHS, announced a formal investigation into Texas Children's Hospital for illegally terminating my employment. And I'm very, very grateful for that. And now I have, to wrap up, I now have the privilege of serving as the founder of Protecting Texas Children. Our mission is to safeguard the innocence of every child by affirming biological truth. We work towards building a future where children can grow up happy, healthy, and whole by not erasing who they are, but by learning to embrace how they've been beautifully created by God. And so I'll end here. What is happening in clinics across the country is not rooted in rigorous science, nor is it grounded in ethical medical practice. It is a marketing campaign masquerading as healthcare. It is a billion-dollar industry that thrives on misleading claims, emotional manipulation, and the systematic erasure of informed consent. The issue of gender medicine has shattered political boundaries and united voices from the right, the left, and the center, not because of ideology, but because of conscience. This is not a partisan battle. This is a battle of good versus evil. And at the end of the day, there are no Democrat children. There are no Republican children, just American children. Thank you.
Thank you so much, Vanessa. Jamie, if you'd like to go.
Good afternoon. My name is Jamie Reed, and I hold a Master's of Science in Clinical Research Management from Washington University in St. Louis, Missouri. I am also a lifelong Democrat, a mom of 5 boys, 3 of whom were adopted out of the foster care system, and I'm a lesbian. I am also the public whistleblower from inside a pediatric gender center. I participated in transitioning nearly 1,500 unique patients who ranged in age from 3 to 26 over almost 5 years. I was once a true believer in pediatric gender medicine. Now I understand I participated in an industry that was based on fraud, deception, and in layman's terms, we were running a racket. Patients with significant comorbidities were treated using unethical and deceptive informed consent practices. They were never properly assessed, informed of their condition, or given a diagnosis. A diagnosis itself is the first required step for any consent to be valid and not fraudulent. These were also vulnerable patients who required specific, special safeguards. First, they were minor patients and should have been provided all of the safeguarding protections we would want for all children. Second, they had significantly presenting comorbidities, often falling within the definition of a stigmatizing complex medical disease, some even meeting the criteria for a legal medical disability. We were harming disabled children. These comorbidities include, but are not limited to, autism spectrum disorders, anxiety, depression, borderline personality disorders, eating disorders, self-harming behaviors, somatization disorders, learning disabilities, ADHD, and significant trauma histories. Third, many of the presenting patients before the social contagion cohort would eventually, if not medically treated, become homosexuals, like me. That is, they will identify as adults as gay, lesbian, or bisexual. The entire diagnosis is based on regressive stereotypes and self-described feelings from minor children and their parents. My clinical experience shows that these, quote, biopsychosocial assessments are not consistent, comprehensive, or truly diagnostic. For an assessment to be diagnostic, there is a very simple way to prove if it actually is so. It is so simple that so many of us actually forget it. There must be a statistically significant number of patients who will not ever meet the diagnostic criteria. So in lay terms, there has to be a statistically significant number of patients and parents who would have been consistently told no by these centers. That never happens. I might hold a Master's of Science in Clinical Research. That is not a requirement to understand the basic concept of medical diagnostics. Parents and the public have been deceived into believing that these assessments are diagnostic, that they're consistent, that they're comprehensive, and that no child is ever receiving treatment without one. If the assessment met the criteria of consistent, comprehensive, and diagnostic, the diagnostic provider should be able to easily produce their assessment tools, give them to the FTC to be analyzed, and they should also be universally consistent across all of our states. This has never happened. And they have not shared any data to show what percentage of those presented are being told no, because this is not happening. But, and this is a huge but, even if this field was actually doing what it claimed to do, even if it was completing a true biopsychosocial assessment and saying no to a significant percentage of the patient population, please know that those who would be told yes would be homosexuals like me, and especially the gender nonconforming homosexuals. Under the Dutch model, we would still be okay to be rendered sterile, without sexual function, with destroyed endocrine systems, and be allowed to die early, simply because we are gender nonconforming homosexuals. And so to some of those not here today, to Laura Edwards-Leeper, to Anna Lou DeVries, we homosexuals are no longer okay to be harmed for straight people's comfort, and we are fighting back. I personally witnessed the consequences of prescribing these treatments without proper informed consent. One of my patients, after her radical bilateral mastectomy at 19, called begging for her breasts to be put back on. This harm has not been contained to children or minors. Another patient's intellectual function was so impaired that they could not identify to me where they lived or explained what type of identification they possessed. Multiple staff members expressed concern about their ability to consent to any medical procedure. Despite these and similar red flags with many patients, this patient even stated that they desired to have biological children, yet they were prescribed a treatment that would ultimately render them sterile for life. We as clinicians in the gender industry openly stated, quote, "It does not matter if patients even met the diagnostic criteria. We did not care. If patients even had, quote, gender dysphoria, we did not care. If a patient said they were trans, then they were trans." Parents were unaware that patients were self-diagnosing, that clinicians had completely abandoned the diagnostic process entirely. Parents who didn't agree with our lies were isolated, abandoned by our centers. We tore married parents apart, and we tore children apart from caring parents who told us no. Imagine in a different field if children went in self-declaring that they had a malignant cancer. If they went to an oncologist, and that oncologist, without labs or biopsies, if that child demanded to go through chemotherapy and surgery, that the clinicians would comply. And then the clinicians would then bill our insurance for those procedures, medical visits, making money for the hospitals and themselves based on this deception. This is precisely what we were doing in the Gender Center. And then we expanded this deception into a racket. We created specific lists of affirming therapists who would do exactly what we wanted. A therapist could only get on that list if they would comply. We needed a letter for insurance, so guess what we did? We wrote it, we made it fill in the blank, we pre-drafted it, and I know this because I am the one who not only created this letter, but I emailed it out to all of those same therapists for hundreds of our patients. I wish I could say to you that I became a whistleblower the first time I heard the nurse say, but Dr. Lewis, we are committing insurance fraud. Because that was said and I didn't. I wish I spoke up sooner. The final death blow to my ethical medical soul, and what finally led me to speak up, is that we significantly harmed our patients. We didn't just deceive them or their parents. I hurt children. And I said to that same Dr. Chris Lewis, Chris, we are harming patients, and he said, I know, but what do you want me to do about it? I hurt the very children I was employed to protect. St. Louis Children's Hospital mission statement is simple. St. Louis Children's Hospital will do what is right for children. We did not, and all of us must now reckon with what we have collectively done.
Thank you so much. Tamara, if you'd like to.
So apparently I was supposed to prepare something written, and I did not. So here goes nothing. I am Tamara Pitsky, and at the time that my story began, I had been a therapist at Multicare Hospital in Washington State for about 5 years. In March of 2023, I had a client come in and say that they identified as a wounded male dog. A female client came in and said that they identified as a wounded male dog. And I did not know what to do with that information. Like, I had heard people come in before and say, like, I feel like I'm actually transgender. And I just had kind of treated them the way I treated any other client, right? We just did therapy on all the different things in their life that were causing them distress. I never felt like I had to have an opinion because I just trusted that people who were working in these gender clinics knew what they were doing. So I felt like, okay, that's whatever, we'll just continue. I'll do what I know how to do. We'll treat anxiety, depression, other issues that are happening in your life. But at this point, when this client came in and said that, I was like, okay, so at what point is someone's identity actually a mental health illness? Like, at what point do we need to press pause and deal with this as if something's going on that needs some medical or some mental health attention? And so I emailed my boss, I emailed my colleagues, and I said, hey, I had a client come in and say that they identified as a wounded male dog, and I don't really know what to do with this. Like, at what point is someone's identity something that we treat as a mental health diagnosis? And they said there's no time that would happen. Like, if this client is not saying that this identity is causing them any distress, then it's fine. Like, you just basically say, awesome, I'm glad you know who you are, and you continue to be a therapist. And my boss was on this email too, and I was like, I don't know how to process this. So I kind of just like set it off to the side and kept kind of like thinking this stuff through, like, what is going on here with gender identity and the way that we are treating these people and these young children who are just trying to figure out who they are? Like, what is happening here? And then September of 2023, we had a mandatory gender affirming care training. None of our trainings up until this point had been mandatory. And I know I'm gonna sound so naive, but I had never heard gender affirming care, those three words together before. And so I was like, what is this? And I just like, had a bad feeling that, because since it was this mandatory training, that we were gonna go in and be like indoctrinated and threatened basically with our, have our jobs threatened. And so it was like the training was supposed to happen after Labor Day weekend. And so I spent every night that weekend, after I put my kids to bed, I sat in bed and I just like researched everything I could about gender affirming care. And I realized like it wasn't that easy to do. Like, I would Google like, what are the dangers of gender affirming care? And the results would be like, how to be a good friend to your LGBTQ. And I was like, what is happening? Like, I came into this situation so naive. Like, I truly had no idea I was like processing it all. And any article that I found or any like organization that I found that was like, we're hurting people. I had written a letter saying that I would not go to this training. And so I wrote this letter and I said, to all the people that I found who were giving a voice to the fact that we're hurting children, I said, please read this for me. Tell me that I'm not wrong because I might lose my job over this. And so I sent it to literally strangers on the internet. And I was like, please tell me that this is the information that I'm putting together here is not wrong. And I got emails back and said, you're not wrong, you're absolutely right, but you have to go to this training because if you don't, you're gonna render yourself irrelevant. They're just gonna fire you and then you lose your influence, so you have to go. And so then we talked through some questions that I could potentially ask, questions, I don't know if you can tell, I am not controversial. I do not wanna make anybody feel like I'm attacking them. So I went into this meeting and I can tell you with certainty that I was like so gentle and so like cautious with like the way I was presenting these questions, but there were 122 of my colleagues there. And when the opportunity presented itself, I said things like, hey, you know, if countries in Europe are like pressing pause on this, why are we mandating this of our clinicians now? And everybody, like, it was a virtual training and the chat box blew up and they were like, you are doing harm to our patients, keep politics out of this. And like, again, I'm so stupid. I was like, politics? Like, I didn't say anything about the president. Like, I don't understand what you're talking about. And so I just like could not believe the hostility. The person that was doing the training was like, I want you to understand, like, we are not gonna, no more of these questions from you. Like, this is not up for debate. And so I left that training and my boss called me and she was like, that was not the correct time or place to ask those questions. Like, oh, okay, I thought that like they had said that we could ask questions, so I just assumed. And so then after that, I just kept like emailing my boss, emailing the person who I did the training, and I asked them these questions in email so I could keep a record of things that they were saying. And I just wanted to make sure that like, am I crazy here? Like, what is happening? And they just kept saying the same response over and over again, no matter what I asked. At no point did anyone say like, okay, hey, let's look at this. What are you seeing online? Let's like look at this research together and figure out whether or not there's anything here that we should like reevaluate. And I just thought that they would. Like, we're here to help people. Like, why would that not be a conversation that they would want to engage in? Instead, they just like decide that I'm a monster. And so they basically just said over and over again, I want you to understand we are not going to agree on this issue. Like, this is best practice. Multicare will not tolerate anything less. And there is no reason why a person's mental health would impact their identity. Like, it doesn't matter if they've had a history of trauma. It doesn't matter if there's co-occurring disorders. It doesn't matter because they know who they are and you're not allowed to question that at all. And so, again, I didn't really know what to do with that. And then I had a client come in, a 13-year-old who was a female who was mostly nonverbal. When we would talk, she would just like continue to scroll on her phone and like rock back and forth. And I kept trying to engage her and it was very challenging. She had a history of trauma, really intense trauma, and shortly after I started seeing her, I saw that she had a gender clinic appointment coming up, her first one, and I asked her how she felt about that, and she said she didn't know she had one. And then she kept scrolling on her phone and we talked about something else. And then after that initial appointment, I read the note and it said, ask your therapist for a letter to start testosterone. And I could tell it was a form letter because I later went back and was like, okay, yeah, they're all the same. But it said that she so eloquently said how distressed she was in her body as a female, which I'm like, there's no way, like she doesn't talk, that's not a thing that happens. And so then her dad asked me to write a letter to start testosterone. And so I was like, finally, now people will actually listen to me. Like, this is obviously not a good candidate. This is a child who's got so much else going on. And so I emailed my boss and I emailed the person who did the training and I said, hey, can we look at this client's chart together? Like, they want me to write this letter for this young child to begin testosterone, and I just feel like there's so many reasons why that's not a good idea. And then I don't think I even got a response back, but my boss came into my office a few days later and was like, I want you to know this has gone above me. Like, the person who did the training has reported you to risk management. And again, I am so dumb. I was like, finally, like, risk management and I can have this conversation together. Like, we can look at how we're hurting this client and realize that, like, we are hurting people. And so I met with risk management numerous times. They ultimately determined that I was the risk. They took the child from me, said I was incompetent to work with, gender distressed young people, and just gave the client to somebody who would just automatically write that letter, no questions asked. And shortly thereafter, I left Multicare. I was like, I can't work for an organization that I don't respect, and I went someplace else. And 3 weeks after starting that new job, my article in the Free Press came out, that new job. They called me up at 7 o'clock that night, and were like, you're just not the right fit for this position. Lost my job, single mom of 3 little kids. I was like, this is like a nightmare situation. I'm so grateful for the Courage Coalition, because I don't know what I would have done had there not been support in place. But I ended up opening my own practice. At the time that I was opening my own practice, I got letters from the state saying I was being investigated for not being gender affirming and for suggesting that gender dysphoria is a mental illness. And so that's where we are today.
Thank you so much. Leda, if you'd like to go.
Hi, I'm very grateful to the FTC for this forum. My name is Leda Boylan. I'm an LPN and a CHES. I worked as an agency nurse in the psych hospital at North Central Healthcare in Wausau, Wisconsin from 2017 until December of last year. North Central is a taxpayer-funded facility. On the adult unit in 2017, I had a 19-year-old trans-identified female patient who had already had a double mastectomy and who nearly bled out because testosterone caused her ovaries to become polycystic, and then they virtually exploded. On the adult unit in 2018, I had a trans-identified male patient in his 20s who was abused so brutally as a child that he was legally blind and had an IQ of about 70 related to a permanent traumatic brain injury. He was prescribed 4 times the amount of estradiol that oral contraceptive contains, in spite of the fact that he was unable to live independently or maintain employment. During the pandemic, North Central Healthcare opened a brand new youth psych unit, and by 2023, it had become not just a unit that I worked on, but the primary unit that I worked on. Many days, every single minor female patient was trans-identified. It was unusual for us to have no trans patients on a given day. Most teenagers experience suicidal ideation at some point. This is not a great part of the human experience, but it is also not an uncommon one. If a child who is struggling discloses suicidal ideation at school, it starts an unceasing cascade of interventions which occur without parental input or consent. School staff are legally obligated to report to law enforcement, who will remove the child to the emergency room, where the child is subjected to medical tests and placed on a 72-hour hold and then delivered to a facility like the one that I worked at. All of this is done without parental consent. Sometimes it is done without any parental contact. The North Central administration is headed by an individual who is well known for a previous scandal in the state of Wisconsin at a facility that is state-run that involves children. She had an unwritten but brutally enforced policy that clinical staff were to call the kids whatever they wanted to be called, and that we were not to inform the children's parents of their desire to socially transition. The implied threat of suicide is wielded with regard to gender dysphoria in a way that is utterly contrary to the standard, which acknowledges both the suggestibility of people who are actively experiencing suicidal ideation, as well as the long-observed phenomenon of suicide clusters, which occur especially often in young people. In other words, they come in, say that they're suicidal, and we say, gosh, we shouldn't discuss that, unless you're trans, in which case we have to do whatever you say. Payer sources are billed fraudulently, utilizing misused codes. Medicaid fraud was commonplace. It was openly discussed during rounding. Most of the children who came in had insurance via their parents' employer. If they did, and the child said, I don't want my parents to know, they had cottoned on to the fact that if they dropped certain codes for insurance, it was going to trigger a letter that would then get back to the parents. We were on the same campus as county social services, which meant then the social work from the inpatient unit would go talk to social services, triggering a CPS investigation, especially if the parents were not married to each other. What would end up happening is the kid would get on Medicaid, then they could bill Medicaid repeatedly for a 72-hour stay, which was also fraudulent because they were misusing codes. So I know HHS and DOJ are here. I don't know if this is an FTC thing. Guys, I used to work for an ACO. Okay, codes are my second language. So right now we have CMS who will not let you bill for, I believe it's I-110 for essential hypertension. It won't weight that for an RAF score, but we can bill for the E29 zero code that is the unspecified endocrine disorder. So we can do that for kids, but we can't do essential hypertension for adults with government payer source healthcare. Make it make sense. My minor patients, who were as young as 11 years old, would want to both impress and fit in with their somewhat older peers. They would frequently change their names and pronouns. This was always kept a secret from parents. Clinical, educational, medical, and mental health professionals of perceived authority who had already proven that they could override the wishes of the child's parents were now also in the business of hiding things from parents. There is no acknowledgement on the part of the administrators who act as accountants, who have no clinical background, who have no scientific degrees, who never interact with patients, who do not do assessments, who have no understanding that science is not an outcome but is in fact a process, that affirming a cross-sex gender identity in children is not a psychologically neutral act. It starts another unstoppable cascade of intervention, but this one ends in permanent sterility, disrupted endocrine systems, sexual dysfunction, mutilated genitalia, and an increased risk of completed suicide by every high-quality study that has been conducted on this issue. To a person, every single trans-identified minor female patient that I took care of described herself as either neurodivergent, same-sex attracted, or a survivor of sexual assault. Some girls were all three. Most were on self-harm precautions and presented with significant scarring. The best part of my job was meeting with parents alone and telling them emphatically, you have to let yourself off the hook. This is bigger than any one family. Yes. The trust that parents and families put in us to care for their beloved children is an awesome responsibility. The parents of my community pay a millage to fund a facility that usurps their rights and engages in iatrogenic harm perpetrated against their children. There is no way for parents to consent to treatments that are neither acknowledged nor explained. How will they ever trust us again?
Thank you so much, Sarah, if you'd like to take us home.
Good afternoon. Thank you to the members of the FTC again for hosting this event. My name is Sarah Stockton, and I'm a licensed marriage and family therapist. Since beginning my training at Syracuse University in 2008, with an emphasis on sex and gender issues, I've spent over a decade developing standards for assessing youth with gender dysphoria, signing hundreds of letters of affirmation, letters for medical interventions, and training other counselors to do so. But today, I'm here as a whistleblower. I've seen children and teens rush into irreversible medical decisions, sometimes after a single session, promised reversible solutions with no chance to learn other ways to manage distress. I've watched families left heartbroken. At Syracuse, I helped develop a comprehensive assessment for gender questioning youth based on the Dutch protocol, emphasizing thorough evaluations to give time to explore identity before medicalization. We were told to market this option so that a child wouldn't have to experience the wrong puberty. Our 2013 assessment tool was designed to give teens and families space to consider past, present, and future expectations while ensuring interventions like puberty blockers were carefully weighed. But what I witnessed was very different. By 2015, gender clinics started popping up and organizations like Planned Parenthood began prescribing hormones without these thorough evaluations. Families were told puberty blockers were fully reversible despite emerging evidence of risks like bone density loss and infertility. Vulnerable teens, including those on the autism spectrum or in foster care, were funneled into medicalization for what were often social difficulties or trauma, not necessarily gender dysphoria. In one case, I met a father very similar to Simon's, who came into my office because the parents were going through a divorce and the child was requesting puberty blockers. I was very concerned about the implications in basically the story that the father was sharing with me. One of the things that we have not talked about enough, and I think we need to talk about, is Munchausen by proxy. I asked the courts to give me some time to talk to the father about his reasonable concerns with puberty blockers. The court overruled me, and within 1 month, the father took his own life. Soon thereafter, a former patient of mine who was seeing me for anxiety issues, who was gay, came into my office distraught after he reported that he was harmed by another therapist who rushed him into medical transition. He was so upset with nowhere to turn to for help. I had never heard of the term detransitioner, and I had never encountered someone who has been this distraught and harmed by what has happened. I tried to help him with emails and calling his providers. They would not provide any guidance or resources of what we could do. No recommendations but to continue his transgender identity. He did not report gender dysphoria. He wanted help for how difficult dating was due to being a gay man. We had been assured that regret was rare if it existed at all, and that affirmation was the only path. Almost every professional I encountered validated that I wasn't just treating children, but saving them. Yes, saving children. In reality, the system was failing them by prioritizing affirmation over developmentally informed therapy, ignoring that in mental health, what we focus on often grows, not diminishes. The pressure to affirm intensified after the pandemic, as I saw spikes in trans identification, particularly among youth on the autism spectrum or those isolated and online during lockdowns. It appeared to me that many were adopting a trans identity to cope with other issues, not necessarily from deep, persistent dysphoria. Schools normalized rapid affirmation, leaving no room for gender nonconforming kids to explore non-medical paths through the natural distress of adolescence. When I raised concerns about a friend group of 4 teens transitioning all together in 1 month, I was silenced and I was told I had no basis to question that. My staff, colleagues, and even courts warned me of professional consequences for questioning the one-size-fits-all approach. Even when I was trained under this protocol, and I did deny adults who were suicidal, but when it was children, it didn't matter. Suicidality only meant to affirm quicker. I eventually decided there was nothing I could do, so I just quietly opened my own private practice and stopped helping youth completely. Many years would pass, and in 2022, I could no longer stay silent. My clients, a lot of them teachers, were bringing in stories of desperation, needing guidance, unable to discuss developmental concerns without risking their careers. Inspired by public discussions, I spoke out in the documentary, What is a Woman? And at Syracuse University in 2023. The result? The backlash was swift. Petitions with thousands of signatures were made against me, public disavowal by my former mentor and co-author of the publication. I was terminated from the University of 15 years and blacklisted from organizations after I was there with 15 years without any formal complaints against me, and every single evaluation was about being my exemplary service. And then my group practice collapsed. But I am here because the truth matters. Our children deserve comprehensive, developmentally informed assessments, not rushed affirmation that they may not fully understand. They need safe, open-ended spaces to explore distress without being pushed toward irreversible medicalization. The FTC must continue investigating misleading claims like life-saving, reversible, that undermine informed consent. I urge you to enforce rigorous standards for youth gender care, protect professionals who raise concerns, and ensure gender nonconforming children have the time and support they need to find their path without coercion. In retrospect, the promise of saving children often meant recommending interventions that would make sure that they and their legacy would no longer exist. It would mean that I would risk their fertility and their sexual function, bypassing all the safeguards we apply in every other area of therapy. You would find it very strange if I told you that I was playing with dildos with 10-year-old typical children. But in this gender-affirming care, that's not only what was taught to me, it was promoted. We were a part of an assembly line, taught that gender-affirming care was the only solution. Today, schools and medical organizations are endorsing the gender affirmation model, medicalizing distress, while social media tells children that finding an identity is the most important part of development, even if it means disconnecting from their embodied selves. I continue to work with individuals with gender dysphoria and those who are gender nonconforming, helping families in custody cases and working with legislators to build safeguards for children. We need to rebuild trust in the medical community while caring for a generation of children who now face disorders of sexual development that we, in part, have caused. When we talk about worrying about suicidality, my biggest fear is that the largest cohort that will end up taking their life are the detransitioners, because they do not know and they do not have a way out. If you cannot transition your sex, there is no way to detransition your sex. And these children are also being told that that is a possibility. I already have children coming in and saying, it doesn't matter if I transition my sex, I can detransition it. You cannot. Our children and their families deserve care, time, and honesty, not promises the medical system cannot keep. Thank you.